All right. Aloha, everyone. It is so good to see you today. I wanted to get started. I want to be very mindful of everyone's time. Thank you to the community, to the co-leads, to everyone who is here. We appreciate you being in attendance. So first off, I'd like to start with some housekeeping before we begin. So this webinar is being recorded and live streamed so that you all know. Please post your questions in the Q&A box. We understand sometimes it's easier in the chat, but it does make it difficult for us to keep track of it and to be able to answer those questions. So if at all possible, please use the Q&A box. So, and again, thank you guys for joining us. We appreciate you being here. And before we begin, as is customary, in our Native Hawaiian and Pacific Islander Hawaii 3R community report. We're going to begin with one of our co-leads, and that is going to be Sherry Daniels today for our Native Hawaiian community. So thank you, Sherry, for joining us, and I'm going to turn the time over to you.
Mahalo Teli, Velina mai kako. Thank you everyone for joining us today. I want to make sure we have enough time for all of our committees to have conversations with everyone. You know, the 3R team has spent the last 2.5, 3 years really working hard with communities. And I'm sure many of you joining on the call today have been part of that during the COVID period. We know that as we start to move into this new era, how do we best continue the work that's been done? And how do we uplift both our Native Hawaiian and Pacific Islander voices and communities? And so today you're going to be hearing from our different committees, data and research, Lisa Watkins-Victorino, our health and well-being with Teli and Kamahana, our communications with Dr. Mario Neha and Kim Ku'ule-Burney, our policy committee with Momi and Charday, as well as our NHPI CHW task force with Jeannie. And I really want to mahalo them for stepping up and sharing with you folks. But also, again, mahalo to you folks listening in and being part of this movement, because it really is a movement. And as we pivot and as we transition to kind of what's next for our communities, we're really looking at continuing our partnership with you all. And we want that. We want to hear your feedback. So please, as Teli said, if you have questions, please put it in the Q&A process, in the Q&A area. You know, I think all of you know the history of our NHPI3R and how we came about and really what the purpose was. And I think over the last several years, we've really demonstrated the ability to model and create a system of collaboration and care that our communities can really thrive in and do the work that we need to do to help uplift all of our communities. And with that, I know at the end, Teli's going to introduce some of our new co-leads, but on behalf of our co-lead group, myself, Dr. Keaweai Moku Kaholokula, Filios and Crystal, we really mahalo you folks for joining us today. Thank you. Teli?
Thank you so much, Sherry. So with that, we're going to go ahead and start our presentation. So again, guys, thank you so much for joining us today. So Keawe, if we can start the presentation. So of course, the first thing is this is a continuation in the series of the report to the community. One thing that we wanted to focus on today, which we thought was important, are the accomplishments of each different committee, the lessons that we have learned and next steps forward. Next slide, please. So as Sherry said, the purpose of the Native Hawaiian and Pacific Islander Hawaii COVID-19 Response, Recovery, and Resilience Team, it was established in May 2020. And the goals or the reasons that we did that were to align with the National NHPI Response Team, to improve the collection and reporting of accurate data, to identify and lend support to initiatives across the Hawaiian Islands, working to address COVID-19 among Native Hawaiians and Pacific Islanders, and to unify and establish a presence in the decision-making processes and policies that impact our communities. So as you can see, we have our 4 leads who were present at the time. We have Sherry, we have Kiave, we have Josie, and Feliai Tao. So thank you to them and for all of their hard work. Next slide, please. And these are just some of the 60, or I should say over 60 organizations that have participated and that are partners with the Native Hawaiian and Pacific Islander 3R team. Next slide, please. The next thing we want to discuss are our core values. And for our core values, I think it's important to note that Native Hawaiians and Pacific Islanders recognize that our core values as Pacific Islander communities resonates with the work we do as individuals, families, and within communities here in Hawaii. We recognize that our cultural protocol and practices are at the forefront and woven into the work that we do on behalf of our communities. So we start with pono, and that is goodness, uprightness, morality, correct or proper procedure, equity, right, just, and virtuous. We will demonstrate the highest moral and ethical behavior in our work and in our interactions. We will be sensitive to our community needs. Aloha, love, affection, compassion, kindness, and grace. We will demonstrate compassion toward all of our Pacific communities, among those whom we serve and for whom we Among those with whom we serve and for whom we serve, we will celebrate our differences and cherish the diversity of needs and perspectives. It's Friday, guys. Sorry about that. The next one is kuleana. So that's our right, privilege, concern, responsibility, authority, and liability. We are responsible to those with whom we work and with whom we serve and to our purpose. We are stewards of our indigenous knowledge, resources, and our community's trust. Ohana, family, related, extended family. We understand that in the Pacific, our community is more important than the individual. Understanding our connectedness to one another, we shall serve toward improving the greater good. Laulima, many hands, cooperation, joint action, or to work together. We shall foster teamwork in all our endeavors and honor the contributions of our colleagues and partners. Imua, forward or to advance. We understand that change is constant and that we must be proactive. Relying on sound science and qualitative data, we shall honor our past as we plan for our future. Next slide, please. And as we think about these core values, it is important that we also recognize some of the barriers. So in this slide, you can see social and cultural determinants of health. So we see historical determinants, social political determinants, social and economic determinants, cultural, and then biological, behavioral, and psychological. As we go through these, what we're really talking about is things that have happened to us in the past, such as depopulation due to the introduction of foreign diseases, socio-political. So that's how colonialism has affected us and continues to be present in our lives today as we address those issues. Social and economic. These are the disparities that we see as our communities deal with jobs, food security, housing, education, marginalization, as well as generational trauma. The cultural determinants of health are, of course, those cultural things which we hold near and dear and what makes engagement either relevant to us or irrelevant. Biological, behavioral, and psychological. And this has to do with our health and well-being. What are we doing, or what are some of the factors that are affecting us, whether it be material, behavioral, biological, psychological, and how do we deal with them? And of course, we also need to include in this spirituality. Next slide, please. And when we're talking about some of the barriers that we unfortunately have to deal with, we also have to discuss social and economical vulnerabilities, or economic, sorry guys. 24% of Native Hawaiians and Pacific Islanders work in essential jobs, such as the military, security, service-related industry, and healthcare. This places many Native Hawaiians and Pacific Islanders in direct and frequent financial and frequent face-to-face contact with the public, and can put them more at risk for communicable diseases such as COVID-19. Native Hawaiians and Pacific Islanders are more likely to have fewer financial resources and to live in large multi-generational households and densely populated neighborhoods. The more people in a household who are essential workers elevates the vulnerability for all household work members. Native Hawaiians are 43% of the incarcerated and 39% of the houseless population in Hawaii. Next slide, please. And then, of course, we also have to recognize our pre-existing health inequities. And these would, what we have to keep in mind is, if you have pre-existing health conditions, you have a higher chance of severe symptoms and hospitalization. So people with chronic diseases such as diabetes, kidney disease, cancer, cardiovascular disease are most vulnerable to having severe symptoms and hospitalizations should they contact COVID-19 or other communicable diseases. And also, you're more likely to have multiple chronic diseases, or Native Hawaiians and Pacific Islanders are more likely to have multiple chronic diseases compared to non-Hispanic whites. Issues hindering timely and quality healthcare are due to 20% of Native Hawaiians and Pacific Islanders not having medical coverage compared to 11.4% of non-Hispanic whites. So, and as well as more Native Hawaiians and Pacific Islanders are on public health insurance programs, such as Medicaid and Medicare. And lastly, Native Hawaiians and Pacific Islanders sadly experience discrimination in healthcare settings and are mistrustful of the medical providers, government agencies, and government-like entities. So what can we do to address these issues? And this is where we go to the next slide. And this is what's important about the work that we have been doing as in the Native Hawaiian and Pacific Islander 3R team. We have 5 separate committees. We have policy, health and well-being, which was previously or formerly TTIV and social support. We have the Native Hawaiian and Pacific Islanders CHW collaborative, communications, and data and research. So in order to discuss what some of our, or to highlight the work that we've been doing, I'd like to first turn the time over to Lisa Watkins Victorino, who is our chair, or one of the chairs for our data and research team. And she will discuss some, or highlight those work that they've been doing from 2001 to 2022. So go ahead, Lisa. Thank you.
Aloha, aloha makea, everyone. Mahalo for joining us. And as Telly said, I'm Lisa Watkins Victorino, and I've been serving as the co-chair on the Data and Research Committee for the last couple of years, and it's truly been my pleasure. And so today we're gonna do an update. Some of you who may have joined us for our last community report might have seen some of this data, but we are gonna do just highlight some updates on data just so that we can show you what kind of what it's looking like at this point in terms of COVID data. And then we'll talk a little bit about what we've been doing and then what we're going to be doing in the next coming year, and perhaps maybe in the next coming 2 years. Next slide. So, you know, when we first started the pandemic, one of the things that we saw was that the Native Hawaiian and Pacific Islander group was being collapsed, and it was more in line, if you're looking at your screen on the left-hand side where you see the green bars, that was what was being reported at the time. by our Department of Health. And if you look at those categories, those of you who are very familiar with race data collection, you can see that they're following sort of that federal standards in reporting with Native Hawaiian and Pacific Islander being lumped together. So when we look at that, we have to think, okay, well, what is it that we really need to know in order to service our communities, in order to have better targeted messaging, better kinds of strategies in order to address COVID. And so what we really needed is to have that data disaggregated. And so this, the Native Hawaiian Pacific Islander COVID-19, the team, the entire team, as well as the data and research team and our partners really advocated to be able to disaggregate that information. So I want you to look at those green bars and see, okay, so we're looking at the green bars, we're seeing, well, okay, we've got 13% here. We're looking at the case percent. And what does that actually mean? And what does it look like in the community if we're really wanting to see what kind of impact it's having? Now, when you disaggregate and you look at the blue bars, we're now looking at the percent of cases by race and ethnicity. And you can see this is the 2020 date. So this is when our Department of Health started to release this data. Wow, what is that picture, right? When we look at the disaggregated, we're seeing that at that time, we saw this really disparate impact on our Pacific Islander population, which we wouldn't have seen. You don't see that, right, in the left side when we're aggregating everything, but you clearly see it once the data is disaggregated. And so what does that tell us? At the beginning, we were able to then really strategize, right, all of our communities in terms of communication, in terms of how are we getting information out, going out to different communities. We could see we were needing to do some really targeted work. Next slide, please. So here's an update, and what I really like about this slide is that you can see it by the different periods of time throughout the pandemic and what was happening. And so when we look at this slide, I want you to kind of focus on our pre-vaccine. And so the dark blue, as you can see here, the dark blue is Native Hawaiian, the light blue is Pacific Islander. So what this slide can show you is how changes over time, what we were seeing in changes over time. So in the pre-vaccine period, we can see that our Pacific Islanders, just as we saw in the previous slide, right, that 25% were impacted. And when you think about this now, Pacific Islanders, as this slide is saying, comprise about 4% of the state population. So we're really seeing that disproportionate impact. Now, as we're moving into our post-vaccine period and then into the Delta variant, you start to see sort of that change occurring. And we now have many more cases in the Native Hawaiian community during the Delta variant period. And of course, that was when our Native Hawaiian population, that percent peaked in that period. And then we have the Omicron period, and we can see that we see those percentages coming down in terms of the cases, which of course we like to think that's because we have a lot of things that were happening that this committee and all of our partners were doing in order to make sure that we were bringing down those cases. Next slide, please. Okay. So now we're looking at the vaccinations. And so this is just basically saying what percent of the population in terms of the state population. And then when we look at the blue, that's our Native Hawaiian and Pacific Islander population and what percent is being vaccinated or was vaccinated. And so we can see overall, when the group is together, we're looking at about 22% as opposed to the 25% in the population. So that tells us we still have some work to do in trying to get our Pacific Islanders and Native Hawaiians vaccinated, when we're looking at them disaggregated, though, we do see that there is still some work that we're wanting to do with our Pacific Island community in particular, because we can see here in the Native Hawaiian community, we're having, we're getting better at vaccinating. We're really at our equivalent in proportion of our population at 21%. Of course, this doesn't mean that we have to stop. We have to constantly make sure that everyone is getting vaccinated. We want to make sure that all of our community, our Native Hawaiian Pacific Islander community, are being vaccinated. Next slide, please. And this is looking at the mortality by race, the rate per 100,000 in the population. This really shows you, this is an updated slide, it really shows you the impact that COVID had on our Pacific Island community in terms of mortality. And so when you take all of these slides together, right, it shows you a picture across time. And then this is that impact of cumulative impact when we're looking at the death summary by race. And we're looking at Pacific Islander and really that disproportionate impact on our Pacific Island community. So the slides taken together show the variations across time as to our communities being impacted, both from the pre-vaccine period all the way through the most current period. We're still seeing impact, not at the same level that we were during that up through, I would say, that Omicron period. We're in a new, I would say it's kind of a new stage of how COVID-19 is experienced. And as we know, we've been having different variants across new strains that have been coming out and being talked about. We do know that as we have more and more people vaccinated, some of the newer information we've seen, that we've all seen in our public reporting or commercials and other kinds of media reporting, that those who are vaccinated and who are still getting COVID may have less symptoms, less symptomatology, right, of that, as well as less strength of those systems. So some are experiencing more flu-like, but we do still have those who are experiencing some very severe symptoms. So we do want to make sure that we continue to collect information to be able to inform how we move forward in this new period of COVID. Next slide, please. So here's the impact for our team in 2021, 2022. We continue to assist in any information needed for targeted testing and vaccination initiatives in our communities. We have facilitated changes in health and systems and state agencies. We did assist the Department of Health in disaggregating Native Hawaiian and Pacific Islander data. We had a lot of advocacy, as you saw in that first slide. And that was in the beginning, 2020. So I would say that in 2021, so that was happening, it got reported, disaggregated. And then in 2021, there was more advocacy to further disaggregate our Pacific Island community, the Pacific Island races. We've been contributing to emerging knowledge over time with different articles and presentations. We've been developing and are just about done and ready to publish or post a comprehensive, complete or minimum list of race categories that we're going to be posting. You'll see that in the next slide or two. And then we've been providing a space for our community stakeholders to kind of discuss and provide others to come in and talk with us, and as well to share information with other entities, government, and nonprofits. Next slide. So this is a really great example. If you can keep clicking through here, thank you. So this is a really great example of when we say advocacy. So if you're looking here, you can see this is the It's disaggregated. We can see Native Hawaiian and Pacific Islander, if you look at rows 2 and 3, are disaggregated. But if you, with the advocacy, what was able to happen in 2021 was to have further disaggregation of our Pacific Islander community. If you can click through and bring up the next, I think if you click through, yeah, and then one more time. And one more time. And there we go. You can see that, which is very helpful, right, for our communities to have that disaggregation of further disaggregation of our Pacific Island communities, different strategies, different communities, different ways to interact and message. Next slide. Here's the list of our standards for the collection of race and ethnicity, or for race in Hawaii. And so we worked hard to really come to this final list that we will be actually posting soon. And so you can see here, we've gone through the disaggregation, of course, of the Native Hawaiian and Pacific Islander, but we have a fairly good list for our Pacific Islander breakout. And then we've been able to show how those would aggregate up to the federal OMB standards, the federal standards for race and for race collection. Next slide. And so this is our national impact. So what you saw previously was our state impact and some of the things that we were doing then. And then for our national impact, we have partnered on different initiatives with the National NHPI response team, with the National Institute on Minority of Health and Health Disparities, with the SEAL project. So Dr. Kaholakula has been working with that. We've shared initially that race, the standards of race list that you saw. Initially, we had 2 forms of that. We have since really just are now promoting and advocating one form, a more complete form, and that has been shared with others nationally, as well as within the state. We've been a part of other publications and conference invitations. Next slide. There we go. These are some of the achievements kind of mentioned in the previous slide. There's publications, presentations, both nationally and internationally. Next slide. So what's next for our group? It's the posting of the standards that you saw earlier. We're hoping to get that done within this next couple of weeks. And then we do have a 1-pager. So the standards that you saw is actually part of a larger document that explains the methodology. It explains some of the practices, best practices in terms of utilizing and having consultation with community in utilizing the standards. And then that's the full document. And we also have a 1-pager that we are going to hopefully disseminate, so that will also be posted, but be able to disseminate within community and with legislators and with other community stakeholders, that kind of puts all of that into a 1-pager that allows them to really quickly see the value of this list, the methodology, and some of the best practices or expectations. We're going to hopefully implement the list, and what does that mean for us? Socializing it within our respective organizations, and then piloting the list. We're also going to be developing a technical guidance, technical and recommended guidance for implementation of those standards, and then develop a scorecard to assess an organization's standards and kind of help them, an organization who's ready to implement this list, because we know that there are a lot of organizations who aren't collecting this level of detailed information. And so we want to be able to kind of say, okay, where are you at? And what is it that you will need to do, or how might you be supported in really moving forward this list? Next slide, please. that's it for us. And I'm going to turn it back over to Joe.
Thank you so much, Lisa. So today I'm going to be doing a little bit of double duty because I was the one behind the scenes that was, or last year, I was working with the TTIV team. So I will be doing their presentation. And also this will be inclusive of social support. So I will also be sharing my time with Kamahana, who was the chair for, or one of the committee chairs for social support. So I'm going to go ahead and get started. So what we're looking at now is the testing, tracing, isolation, and vaccination. And the purpose of that team was to address the needs of Native Hawaiians and Pacific Islanders, especially when it came to COVID-19 testing, tracing, isolation, and vaccination. We were advocates within the community, but we also helped in supporting and setting up mobile vaccination clinics. Some of the ongoing work that we were doing as well was we were supporting and advising the hiring processes of statewide NHPI contact tracers. We supported vaccination and testing events. The support, of course, was in language and culturally appropriate, as well as educational, or was inclusive of educational outreach. And we collaborated with health systems and organizations to support community health worker training and education to better serve Native Hawaiians and Pacific Islanders. So first, I want to talk about our vaccination and testing. Next slide, please. So if you look at our vaccination and testing, what you can see is these were not in medical offices. So what we understood about our communities is that we needed to meet them where they were at. So oftentimes it was in FQHCs, or federally qualified health centers, which is also a medical center, just to be clear, but it was one that's located and embedded within the community. We have churches, we were at schools, we were at known sites, which created a feeling of safety for our community members. Next slide, please. We, of course, did over-the-counter self-test distribution and education, which was very important. So you can see that this slide shows one of our initiatives where we worked with the Native Hawaiian homestead, particularly those in the Kapolei area. So we go Kako. And during those that campaign, we provided free over-the-counter test kits, as well as educational outreach and vaccination clinics. And below that postcard that we sent out are some of our partners who worked with us. Next slide, please. In language interpretation is very important. So you can see here members of MCO, MHAC, WOW, We Are Oceania, as well as some of Team 6B, which was the Native Hawaiian and Pacific Islander contact tracing team. What's important to realize is that when engagement is lacking language, so we don't speak the language, then we have a difficult time interacting and creating meaningful engagement between those communities which we're trying to interact with and address. So it's very important that we have there on site community members who look like the community, sound like the community, and understand their needs. Next slide, please. And then, of course, we have our educational outreach or health literacy. And you can see here again the importance. This was hosted by Papaola Lokagi, but the importance of having community members or trusted messengers there to provide the information. I don't know about the rest of you, but it has been my experience that when I am in a situation and I see somebody who looks like me, sounds like me, and understands me, I am more likely to trust the information that they're sharing with me than if it's somebody that I don't know or who doesn't look like me or sound like me. So that's important. Next slide, please. And then, of course, we have our media, social media campaigns, which comms will go into more in depth, but we did want to highlight that we worked in conjunction with them. But also, if you look at the media flyers that we used, again, we wanted to make sure that the community understood who this was for. So we tried to portray or represent those communities that we were interacting with. And then for the next slide, I am actually going to turn it over to Kamahana, who again was one of the co-chairs for the social support and recovery team, and she will present for this. Thanks, Kamahana.
Aloha mai kako. Thank you, Telly, and thanks to the people that went before us. So I had the privilege since 2020, since we first started, to work with social supports. And I would be remiss not to acknowledge the work of Kau'i, the co-chair, and our team. So last year we talked about the values that were established from our leadership team at the very onset of our work together. And then the foundation, you can see in this slide here, how it was really important for us to have this process and foundation set so we could then develop our strategy. And we wanted to make sure, because we heard across the teams and throughout the Hawaiian Islands in communities, that it was really important that we addressed advocacy, education, and that we helped make it known and aware to people what some of the barriers were in terms of access to care. So we used this past year to really establish very strong partnerships so that we could leverage our community resources. Next slide, please. So in terms of the food distribution, so the social supports is kind of highlighting the boots on the ground, the people who worked every day, all day long, in hearing and connecting with community, establishing what the needs were, and then connecting community to organizations, community-based organizations that could help provide support. And in the food distribution and healthcare, I wanted to go ahead and highlight one of our community partners, Project Vision. So when we were on Molokai and we had a health fair, Project Vision was able to come to Molokai, bring a nurse with them so we could add on testing and a vaccination. And we saw like truckloads of families and community members come through. So because of COVID, we had to have our health fair be a drive-through health fair, and we had all of our different departments and departments available so folks could just drive through. But without Project Vision being on site to offer us the testing and vaccine, it would have been really difficult for us with our limited resources on island. Next slide, please. And another great accomplishment that I would like to highlight is the cultural engagement. And for this, this happened throughout the Hawaiian Islands. But the group that I wanted to highlight today for all of us would be our folks, our partners in Papakolea. And they ensured whether it was food, whether it was testing, whether it was vaccination, flu vaccine, COVID vaccine, that they were culturally relevant. They made sure that their kupuna were taken care of, that their traditional Hawaiian practices were continued at community gardens. So Papakolea is a really great example of a homestead community that is well connected and able to respond quickly to the needs of their community. Next slide, please. And I'll go ahead and turn it over to Telly for this one.
Thank you, guys.
Sure.
So, of course, now with the new team, which is health and well-being, let's talk about next steps forward. And so one thing that they wanted to make sure that they were mindful of is they wanted to define health and well-being so that it was inclusive of culture and language. As we understand that minus culture and language, engagement is lacking and community participation is low. Support and align the committee's goals with other committees and 3R grant efforts. Partner with community-based organization and social media and social and medical providers to offer preventative care to NHPI community members. Complete an initial organization assessment to determine their needs and goals, report findings back to the community, and create a work plan to address those needs and meet their goals. Provide educational outreaches addressing social determinants of health that are in language and culturally appropriate. Partner with other organizations to assist with prenatal and postpartum care. Assist community-based organizations and social and medical providers with engaging and addressing mental health issues in Native Hawaiian and Pacific Islander communities. Advocate for access to better healthcare, affordable housing, education and employment pathways, environmental issues, food sustainability, and address better equity and representation across all areas. Sponsor and support health fairs in Native Hawaiian and Pacific Islander communities. I know that sounds like a lot, and we understand that we may not be able to address all of those needs, but we want to be aware of them so that as we move forward, we have the situational awareness necessary in order to provide appropriate feedback and narratives that are representative of our communities. Next slide, please. And for this, I'm going to turn it over to Mary Oneha, who is the communications chair, and she will present for that committee.
Aloha and welcome. Thank you so much, Tali. As Tali mentioned, I am the chair of the communications committee for NHPI3R and also the CEO of Waimanalo Health Center. So before I start, I just want to express my deep gratitude to Kim Burney for all of her efforts, her steadfastness, her expertise, and her unending support of this committee. I would also like to thank the members of this committee for their time and valued input. So the aim of the Communications Committee was to provide the technical assistance and consultation to ensure that COVID-19 related communication materials could be used effectively and appropriately with NHPI communities, free of bias, offensive, and discriminatory language or racist content, imagery, and dissemination tactics. In addition, the committee identified COVID-19 related communication gaps and needs within NHPI communities and strategies for the committee members to implement. So as COVID evolves, so too will the charge of this committee. So as you can see on this slide, at the beginning of COVID, these were the headlines that clearly indicated the gaps for NHPI communities hardest hit in Hawaii as language barriers and health disparities. Next slide. So culture appropriate information was developed and shared. A variety of media releases and local news stories were published. Weekly bulletins were produced, providing critical information for NHPI partners and communities. And a website stores a wealth of resources. So you can check out the website at nhpicovidhawaii.net. Next slide. There were also a variety of tools used by the Communications Committee and associated partners to get accurate, appropriate, and in-language information to communities as webinars, including a series titled Ask a Kauka, historical information and resources to address social challenges as housing was also presented. Next slide. So there were campaigns by partners, including 2 art contests, more than 4 concerts, health fairs, and Lahui Kanaka implemented by Kumuhula. There were media broadcasts, numerous PSAs, radio campaigns across 3 media groups, mall and bus signs. Toolkits were also developed as woven with elders and Keeping Our Ohana Safe, which provided decision-making guidance for large group gatherings. So in summary, the Communications Committee continues to meet twice a month on the 1st and 3rd Thursdays of the month. The committee reviews updates on COVID data, partner updates, other NHPI3R committee updates, and then we identify and discuss any top of mind issues or gaps members and communities are experiencing or that the other committees would like communications to assist with. So current topics being discussed include, as Lisa presented, the dissemination of a data collection form related to disaggregated NHPI race data, and then sharing information through a webinar about individuals' experiences with long COVID. So as COVID evolves, as I mentioned, so too will this committee. There is still much to be addressed in achieving equity with NHPI communities. Thank you, Tali.
Oops, sorry, Kiave. Next slide, please. And we also want to make mention, because they helped with our comms team or with a lot of our communication efforts, our resource partners. So those included Kaiser Permanente, the Hawaii State Department of Health, Hawaii Community Foundation, Morehouse, APIA, my apologies, Walmart, NCAPIP, and the Urban Institute. So thank you so much to all of them, because without their financial support, our communication committee would not have been able to do as much as they did, because without the money, we're not able to pay the bills. So thank you, Mary, for that presentation. Next slide, please. We're going to go to Momilani Marshall, who will be presenting on behalf of the policy team. So thank you so much for that, Momi. I'll turn the time over to you.
Aloha mai kako, mahalo Teli, and for the rest of the panelists, and especially for everyone that makes the NHPI3R team happen and work so much that goes on behind the scenes that many of us are not aware of. So I just want to say mahalo nui for all of that and for the opportunity to be a part of the committee. I'm on the policy subcommittee. We meet, oh goodness, I think it's Mondays. I think it was Monday afternoons. And so what I just want to share is a little bit of what we do as a policy subcommittee and some of the activities that we've been involved in. And so during the 2021-2022 legislative session, the policy subcommittee submitted a total of 13 testimony for 10 unique bills. A little bit later, I'll outline all of the 10 unique bills. But here, next to this is sort of a word cloud that just gives you an indication of what were the content of those bills, how we decided what we would advocate for, what needed to be supported, what we felt like were priorities. And as you can see, Hawaiian health, Pacific Islander health, and relationships in our communities were what really drove the activity of the policy subcommittee. In addition to the legislative activities, we were also involved with publishing a manuscript with the Hawaii Journal of Health and Social Welfare that highlighted an Indigenous framework that we use to help inform our activities, to provide us with guidance and direction. And then we did participate in 4 different national conferences to sort of disseminate the knowledge to make sure that the Native Hawaiian and Pacific Islander voice was being represented on that national stage, and just to elevate this conversation about health disparities and health equity here in Hawaii. Next slide, please. So one of the strengths, one of the innovations I feel is inherent in the NHPI3R team as a whole is that we conceptualize health very broadly, not just a medical model of health, but this broad understanding of health that touches so many areas of life, kind of the that schematic we saw earlier of Malleola and all of these determinants and all of these factors that really impact the health, not just of an individual, but of a community and then of a society, of our lahui here in Hawaii. And so health was really conceptualized very broadly, where housing is health, culture is seen as impacting health, data disaggregation is seen as impacting the health and the well-being of our communities here in Hawaii. And so these were some of the policy committee priorities that were highlighted throughout these different months. And thank you so much for Kim Burney and all the work of Sarah Kamakapiwa-Ole and so many individuals who helped put together all of this information in a way that is digestible, easy to understand, and can be presented to a community. Because if we keep this information siloed just here with our 3R team or in academic circles or in government agencies, and it never gets out to the community, we never make an impact where we're really intending to make that impact, what provides us with motivation and what compels us to keep doing the work. And so this is just sort of a broad view of some of the policy issues. Next slide. Here's more specifically the different legislative bills that were highlighted as priorities, and that different testimony were submitted in support or in opposition to. And so these 10 different bills were ones that came up and were brought to the attention of the policy committee, and letters were written or advocacy efforts were built around these different bills. But one of the things that was impressed upon us is that effective policy making is only as good as the data that we're working with. As Lisa mentioned, that disaggregated data is something that we need. And if we don't have disaggregated data, then our interpretation of the data and what informs our advocacy efforts will not be as strong or as effective as it needs to be. So we'll have policies that are ineffective, that are not making a difference in our communities and not moving that needle of disparity. And so policy making, while it is so instrumental in making changes in the community, it's built on this much bigger foundation of needing disaggregated data and the efforts of committees that really push for national recognition that we need to look at this granular level of our communities, because if we don't have accurate data, we don't have effective policies. Next slide, please. So one of the ways that we tried to help inform our efforts as a committee was to look at an Indigenous understanding of health, that broad description of health and all of the different factors, and to try to shape our advocacy and our efforts around an Indigenous understanding of health. And so this Indigenous health framework that we adopted as a committee is based on the work of Dr. Blaisdell and is called the 3 PICO model. And it really shows us how we need to build outward from what we bring as Native Hawaiian and Pacific Islander communities, something that is inherent and unique to us, and that's that ancestral wisdom, that Ike Kupuna. And then going outward from that is when we want to arrive at what's really compelling us is to make a difference at the community level and the communal outcomes. And so I just want to show you and walk you through a little bit of how we use this model to bring to bear different issues that we advocated for, and then the way that we presented it on the national stage. Next slide, please. So when we talked about Ike Kupuna and we talked about Indigenous ways of knowing, traditional knowledge, ancestral technologies, really, ancestral sciences. One of the bills was HCR3 SCR5, and that was about data disaggregation and improved data governance. Because in itself, that's not what we're looking for. What we're looking for is effective and accurate resource allocation. And this is not a new understanding of how to accomplish that. If we look back into Hawaiian history, we can see here is Hawaii Island, Maimoku, that's where I am, over here on Hawaii Island. And one of the chiefs, Umialiloa, had a way of doing a census of the entire island. In the Ahupua'a system, he had each member of every community bring a rock. So from the youngest keiki, who brought pebbles, up to warriors who brought larger stones, they put them into piles so that there could be a visual representation of where we need to put our resource allocation. Well, if you apply that ancestral technology to our contemporary problem, we need disaggregated data on this level so we can know where to put our resources. And so this bill and these initiatives were ones that we supported and submitted testimony for. Next slide, please. And so in this Indigenous understanding of health, and what guided our efforts was this awareness of self-awareness, our cultural and our spiritual grounding and relationships. So another advocacy effort was around HR 83 HCR 89, or what's known as Team 6B, where the Department of Health was urged to continue employing this very innovative team, investigative team, that helped to move that needle of disparity by being, as Telly said, those trusted messengers that went into these communities. They spoke the language, they looked like community members, they were community members. And so they had that trust of the community and were able to bring what was essentially sort of a Western understanding of what was happening and a Western intervention, this vaccination, into a community who had an embedded distrust for these Western approaches and these Western interventions, and we're able to bridge that gap. Well, the only way that we're going to be able to move health disparities is if we employ people who are trusted messengers who can go into these communities who have historical distrust based on historical trauma and cultural discrimination. And so Team 6B and their efforts were one of the bills that we helped to support. Next slide, please. Another issue had to do with the underground fuel storage tanks at Red Hill, and our understanding of how these storage tanks are above not just a water source, but a source of life for the islands. Our understanding that our VI is what gives life to these islands. We don't have options to, redirect a river from another state. This is what we have, and we need to be stewards of it. And this underground fuel storage tanks that were leaking and had been placed in a position that would not have been wise if we had been looking at our natural resources and being stewards of that. And so this was another bill that we submitted testimony and advocated to support. Next slide, please. So really what we're striving to do is to make changes on the community level, these communal outcomes. And as so many of my colleagues have mentioned about what was happening in the community, here is just a little snapshot of the dashboard that was so helpful in visualizing data disaggregation and allowing policymakers, concerned community members, stakeholders, government agencies, academics to go in to look at the data on this very specific level so that we could come up with specific solutions, specific interventions, and advocacy around these bills. And another product that would help move this needle disparity is the Health Equity Report, which was written by our community members looking at our health concerns and what is happening in our populations, not from an outside perspective, but from an inside perspective. So really that's what drives the efforts of our team. So as I mentioned earlier, we were just active with legislative efforts, but also with this Western model of peer-reviewed publications and getting the knowledge out into the hands of academics, but also onto the national stage, making sure that our voice of Native Hawaiian Pacific Islanders was being represented accurately across the nation. So thank you, Telly.
Thanks, Mommy, for that awesome presentation. Thank you. And of course to everyone else. And then next presentation will be by Jeannie, who is part of our CHW collaborative. She'll be presenting, and just so that you guys know, this is something new that we just started in 2022. Before that, of course, we know that CHWs have been around for a long time. These are our community connectors, our navigators, and because of COVID-19, as well as ongoing social and economic issues, it was important for Native Hawaiians and Pacific Islanders to create their own collaborative network so that way they could support each other. So with that, I'm going to go ahead and turn this over to Jeannie. Thank you so much, Jeannie.
Thank you, Telly. So as you see on this slide here, the first point, community health workers positively affected underserved and marginalized communities. We assist clients through all social determinants of health. Daily, we help with uninsured and underinsured, hungry, the houseless, and we work in all areas of disparity. And recently, 2 years ago, found ourselves working with a new disease called COVID, finding ourselves working in areas that CHOWs were not really trained in. So we learned, we trained, we worked together with the same mission of helping families through this time of hardship. We serve as liaisons between medical and social service. We introduce and connect people with the services they need, whether it is medical or social services. We advocate for change in cultural competency of services delivered, as well as, as well as improving access to quality care. The key here is to meet people where they're at. Let them decide after all options are on the table with how they would like to proceed, and focus on what's important to them and help them reach their full potential. Be the one-stop shop where the client feels that you're doing all that you can do for them. And the last point on this slide, we build individual and community health knowledge and self-sufficiency through a range of activities. Well, CHOW work is constant. CHOW work is a heart to serve. A community health worker, is a person who wants to see change for an individual, a situation, or a community. And it is through our outreach, education, informal counseling, social support, and advocacy that a CHOW finds a way to solve certain problems or situations. They collaborate with others to make it happen. Through the COVID POW events, we educated the communities through these sometimes 6 events per week with COVID vaccinations and the importance of getting vaccinated, with our teams giving out thousands of PPEs and home test kits to community families. It reminds me of a story. I was doing my master's in criminal justice, and the teacher had asked me, well, what do you want to do in life after you finish with your degree? And I said, well, I want to end domestic violence. And she stood there in front of me and she laughed. And I was like, oh, how dare you laugh? I do want to end domestic violence. And then she said this, and it ricocheted to my life the rest of the way. And that is that we are just a pebble in that pond. And that once that pebble is thrown into the pond, a ripple effect happens. And that's exactly what we're doing here. Together, CHOWs work together no matter where they come from. Next slide. And no matter what agency they are working in, we all help each other. So this next slide showcases just some of that, how CHOWs, community health workers, a small, as you can see, there's more pictures in this, small portion of agencies that work together in the Native Hawaiian Pacific Islander movement. Through the last couple of years, we were already doing the work, but through the NHPI Collaborative, we were able to advocate with each other, outreach, and enroll more people for services, navigate and connect people to more services. And even if we were all giving the same type of service, there was no feeling of competition. We worked together. The attitude to help as many people as we possibly could, built relationships and partnerships throughout the entire time. I don't want to say COVID was good, because it wasn't good, but it did bring a lot of the CHOWs together. We help people get their basic needs met through food distributions, COVID vaccinations, and even found the time to make these people happy by giving them and their children a Christmas to remember through our partnered agencies. This is a passion for us. This is something we did knowing that we could get sick in the community from a virus that took lives, some of our own families. So we went out, we masked up, we vaccinated, and we still found compassion in our hearts to help get these people social service, education, medical, and social emotional support. We networked, collaborated, and continued to affect our communities that most of us live in. So I have before I move on to the next slide, I actually live by I mentioned that one-stop shop, but I live by a model which I call the 4 E's to success. The first E is evaluate. We want to evaluate each and every client situation. And the second is educate. We want to educate them and in what is needed to get them to where they need to get to. We want to encourage them. We encourage them to continue through all the ups and downs of life. And the last one, because we don't want a revolving door. I mean, if they have to come back, of course, but the last one is empower. We want to empower them, give them the resources, and help them move to get to the better, right? So last slide for me. And that slide just shows what we are actually, excuse me, sorry. It shows what our next steps are moving forward. So we are, like Telly said, a collaboration that just started in 2022, but like she said, we've already been doing this. The Native Hawaiian Pacific Islander Community Health Worker trainings, creating a Native Hawaiian Pacific Islander Community Health Worker curriculum, the NHPI Child Support System and infrastructure building, resource website, you know, starting our mission statement, logo, and vision. And some of this is already started, and some of them we're going to get to. We have the phone tree and collaboration contact list, the educational support, social media support through our campaigns that are in language and culturally appropriate. SB 2882 was a bill that happened that didn't actually take off, and that is because the child spoke up and said, no, this is not what we want. We want to still be a child, but not be told that we need to be certified. We want to be recognized. And so that is, you know, that stemmed a tier system in place for that type of certification. Financial sustainability, create a system to define lived life experiences, because it's through those stories that people get healed. Scholarship support, because we don't ever want to limit a community health worker. If they want to be one day a doctor, let's support that. Pathways for childs from high school certificate to create jobs. We want to make sure high school students are understanding what community health work is. You know, I've been doing community health work for about 30 years now, and I never knew I actually did the work until I got the title 10 years ago. So that's very strange in my eyes. But, you know, when you have the passion to help and assist people, you are a community health worker. Internship programs for high school with the community-based organizations. And I'll leave lastly with the end right area, the community report for Native Hawaiian Pacific Islander Community Health Worker Survey findings. The survey was completed. It's finished it in November of 2022. Now is the compiling and the actual report. The date and time is to be determined, but go ahead and look out for that. And thank you, Telly.
Of course. Thank you so much, Jeannie. So those are our 5 committees that we have in place at this time. So now we're going to talk about the pivot. And, you know, the pivot is based on recommendations from Native Hawaiian and Pacific Islander community team members. And what we wanted to do was identify intersections with other recovery plans, initiatives, community-based organizations, religious institutions, government agencies, elected officials, educational institutions, and community leaders. And if you look at the middle circle, partners address NHPI needs. You see, number 1, identify the need. Number 2, create a solution. Number 3, resources and partners. Number 4, we want to empower the community. Number 5, we look to coordinate our efforts. And number 6, we want to be advocates for change. So next slide, please. So first, I want to talk about our a'ali'i evaluation. So the NHPI3R team, with the support of Papaololokahi, of course, as they are our backbone, we went out and we were looking for someone who could come out and talk to the team and discuss, just take an evaluation, take the temperature of community members, find out where we're at, where we're going, and how we want this to look moving forward. So they did a focus group with each of our committees. They surveyed all of our committee members, which was a total, at the time, there were 39 who actively participated in focus groups, answered questions, and took the survey. And The groups lasted anywhere between 50 to 120 minutes, depending on who was a part of the group, as well as the number of participants that were there. Next slide, please. And so, of course, what's important to us as Pacific Islanders is our stories. So what they did was they put together a mo'olelo so that way we have a narrative, a story of what's happening or what happened with the NHPI3R team. So the mo'olelo of the accomplishments that people will share about NHPI include everything that you have seen today and so much more. And of course, as we make this available to all of you, you guys can read this. But basically, again, it just supports the stories that you have heard today. So next slide, please. Some of the quotes, though, that I thought were important that came out of the committee interviews. And this was the strength of work. And this was based on the question, what are our strengths of working together as Native Hawaiians and Pacific Islanders? One of them was, we really exemplified how to work across silos based on the different communities and how to work together. Right before I got the call, there was a very strange silence in Hawaii, a scary silence. We had no idea what was coming. And then we got the call. It didn't take us long to respond. The next one, we found those of us who would run into the fire and those who would stay on the side. That's the amazing part of this group. Next slide, please. And so what does this mo'olelo tell us about us? The stories that you've heard, the quotes that you just heard, the original purpose for convening the NHPI3R team stemmed from the various adversities members were experiencing: the COVID lockdowns, social and health disparities, the feeling of being isolated as a service provider with no pandemic game plan to follow. These stories coming out of the NHPI3R will highlight mostly positive experiences, as we showed you today, stronger networks, which you heard a lot of and saw pictures of today, superb leadership in the NHPI3R community, and greater efficacy among participants to address the disparities facing Native Hawaiian and Pacific Islander communities. And of course, future efforts will do well to employ Indigenous community engagement and principles that emphasize trust building, managing conflict with aloha, and building and amplifying diverse backgrounds. Next slide, please. So the quote for that mo'olelo, which I found to be very helpful and I wanted to share with you today, was, we found those of us who would run into the fire and those of us who would stay on the side. That's the amazing part of this group. I'll use that again. We really exemplified how to work across silo based on the different committees and how to work together. And you saw the amazing strength of people to do this and to help each other, which I think is super important to highlight. Next slide, please. But then, of course, as we are coming to the end of the pandemic, that doesn't mean that COVID is gone. That simply means that COVID needs to be incorporated into our daily lives and our next steps forward. So these were the signs of change. The NHPI3R participants acknowledged that many in the community are tired of being in a pandemic and are ready for the pandemic to stop being the most important topic in their lives. We all have COVID fatigue. I'm sure all of you have experienced it, as have I, and we are ready to move on. Others are concerned society is simply moving toward accepting disproportionate deaths and suffering from Native Hawaiian and Pacific Islander communities and other disadvantaged communities, and they find acquiescence unacceptable. This is an important statement because I think what we're saying here is we realize that because of the disparities and because Native Hawaiians and Pacific Islanders have been overrepresented in COVID-19 cases and deaths, we can't simply act as if COVID now does not exist. We need to be mindful and we need to address the social determinants of health that continue to place Native Hawaiians and Pacific Islanders at risk. Other signs of change are favorable. Many notice that because NHPI voices, or Native Hawaiian and Pacific Islander voices, have some representation, the status quo is pushing back. We're no longer to just accept whatever is given to us. We know that we need to ask, and we're asking for those services and resources that are necessary to ensure equitable equity and representation, right, guys? We all need a seat at the table. If not, we're going to build our own table, build our own chairs, and they can come join us. Not sure how that's going to work, but that's what we're looking at. Increased representation is a sign that some things have changed. The question here, though, for that statement is it going to continue to change, or is once the pandemic over, will we go back to pre-pandemic normal? I don't know about the rest of you, but going back to normal is not where I want to be. I want to make sure that those changes that have happened, such as Native Hawaiians and Pacific Islanders being hired and represented in government agencies, continues, and that this just wasn't simply an emergency situation. And a sign that some things have changed, but until disparities change, much more work remains. We all know that the work is ongoing, and it seems like there's never an end. So we want to make sure that we're creating a support system that doesn't burn out our Native Hawaiian and Pacific Islander community members, leaders, or organizations. And so finally, we need to think about NHPI3R participants have noticed committee attendance declining and are wondering what lies ahead for the initiative. And I think that's important because really what we're talking about here is where are we heading to? And this is why we wanted to hold this community report today, but also why we wanted to talk about the pivot. And the pivot is going to mean expanding the reach of the NHPI3R COVID team to go beyond COVID-19. So when we talk about response, what we're talking about, because we're going to keep the 3 R's, response, recovery, resilience. And so when we look at response, what we're talking about is how do we as Native Hawaiians and Pacific Islanders respond to times of crisis, inequities, underrepresentation, or any situation which puts us or who we are at the bottom of the barrel. And then we want to talk about recovery. What does recovery look like? Recovery should look like systemic changes that are being put in place to ensure that Native Hawaiians and Pacific Islanders are moving that needle of disparity more towards the middle so that our community members, our keiki, those who come after us, will not have to go through the same thing that we have, that they won't face the discrimination, the stereotypes, or the socioeconomic deficiencies that we have, that they'll have access to healthcare, that they won't be the underinsured or uninsured. Next slide, please. And so as part of this, we want to talk about some of the quotes that were given. Cultural pride is a powerful thing. When we privilege our own culture, people will take notice. I've seen it in spaces where people claim their Native Hawaiian Pacific Islander-ness. At times, we get so bogged down in how do I survive in a white system. When we privilege our systems, it's going to work out. That means that we need to look at Indigenous and Native knowledge and methodologies, and we need to put that at the top and then move from there, which is what you heard today, and you saw examples of it. We need to have people at the table to address microaggressions. I see people digging in their heels because they don't like change. We're all human beings. None of us like change. But as we have learned through the pandemic, we need to get comfortable with being uncomfortable. I think I did a whole webinar on that Lisa hosted, Lisa Ka'anoi, who is one of our participants, and we laughed through most of it. But at the end, what we all walked away with is we need to be comfortable with who we are and stop apologizing for ourselves or for our culture or our languages. The last one is people are sick of COVID and they want to get back to living. So if we think about that last quote, what does getting back to living mean? What that should mean is we're living a life that's healthy and that we're not simply accepting the disparities or the health inequities that our communities suffer or have been suffering that have led to generational trauma. And how do we do that? We make better choices. We create educational outreach that is in language and that is culturally appropriate and cultural safe spaces. And along with that, we expand our scope, which is ultimately what we will be doing with the NHPI3R. Next slide, please. So some of the findings that we need to talk about. Number one, we want to increase equity and representation of Native Hawaiians and Pacific Islanders. Each of our teams will be working towards equity and representation. It's a part of all of their goals, and it's really a foundational piece of the NHPI3R team. Next, continued collaboration across Native Hawaiian and Pacific Islander communities. It's very difficult sometimes to be able to work with other communities of color because oftentimes we're competing for the same financial resources. But what we found during COVID-19 is that instead of competing, we can help support each other so that way we have those relationships in place. Because with one finger, as was pointed out to me, I can push. It's a little uncomfortable. It might, you might feel it now and again, but it's not much. But if I take all of my hand and I ball it up and I hit you like this, I'm going to move that wall. I'm going to make a difference because I'm not acting as one person. I'm acting as a group. So we need to keep that collaboration together. And no, I'm not advocating violence. That's just the example that was given to me by one of my professors. So I just want to be clear about that. The next one is work to de-silo all systems that serve communities and bring about systemic equity. And that's what we're doing in sharing this with you. And as you saw from our community reports from our committees, we're working together. You saw data disaggregation. It was talked about not only by our data and research team, but also it affected policy as well as social support and CHWs, as well as our testing, tracing, investigation, our TTIV team. Number 4, continued work in public health systems. That is so important. And that's why it's important that we see our FQHCs here. So to Dr. Kintu, as well as Dr. Mary Oneha, for their presence here, we're making sure that we have Native Hawaiians and Pacific Islanders and those in their community who are serving them, such as the FQHCs, such as Project Vision, such as Keola Mamo, at the table so that they're aware of what the community needs are, but also to make sure that we know what their needs are. In a relationship, it's all about give and take. It's reciprocity. I'm going to share with you what I need. You're going to share with me what you need. And in the middle is where we're going to find the solution. Communications, internal and external to the NHPI3R. Again, that's why we're here doing a community report and why at the end, we're going to invite all of you to participate in a committee that you feel is appropriate for you. Because minus the support of the community, minus the input of those medical providers or social service providers, we struggle to create an infrastructure or to build capacity within our communities. So we need to have communication. And then finally, lastly, leadership development and resource development. And this is so important. I like the puñado. And this is so important because we need to make sure that we are building up leadership within our Native Hawaiian and Pacific Islander community. We all have voices. My background is in Pacific Island studies. And many of the authors and academic Indigenous Native methodologies, resources that I rely upon are Native Hawaiians and Pacific Islanders who have wrote about their experiences. And what we know is if we want to make changes, we have to foster leadership, but we also have to foster empowerment. Native Hawaiians and Pacific Islanders were not simply waiting to be discovered by colonial powers or entities. They were thriving communities that were civilized. They had thoughts, they had ideas, they had infrastructures. They were traveling the Pacific before anyone from the West ever decided to build a boat and come and find us. And we need to remember that, because as we empower our community, we create better leaders who will advocate and understand their worth and who will build on the work that has already been done. Next slide, please. So what are our Native Hawaiian and Pacific Islander or 3R priorities and recommendations? And you can see here, and again, we will be sharing this slide with you. We have examples from all of our committees. For those that will be, we weren't able to add the CHW, so our apologies for that, but many of them participated with our social support or TTIV. And so if you look at that, what they've pointed out is language access, sustainable funding. How do we find monies? It's awesome that people expect us to do everything for free, but I don't know about you, I need to pay my bills. And along with paying my bills, when I went to school to get higher education, when I went to college, oddly enough, my teachers did not want to teach me for free. They all charged me, which is why I had to pay tuition. So it is important that we create sustainable financial resources in order to make sure that the work that we're doing now continues as we move forward. We need to establish community-led advocacy. This is something that I think is so important. In Samoa, what we understand, and I believe this is true across the Pacific, at least it has been in my experience, that if you want to solve an issue, you go to the source. And then you allow the source to create that issue and you find a way to make it happen. That's important. We don't need people showing up and telling community members how to solve their problems when they are not a part of the community. They don't understand the language, the culture, or the colonial history, or the history before colonization. We need community members who understand all of this and are able to speak from their own lived life experiences. And of course, in recovery, we need to address social and cultural determinants of health. What can we do to make our community members healthier and to address their well-being, which is inclusive of their culture, their language, and their spirituality? And as we talked about with policy, good policy is predicated upon correct data. Data is never neutral. Data needs to be contextualized by community narratives that ensures that the data collected is telling the story that the community is living and that it has not been co-opted by government agencies or whoever in order to serve their needs or their desires. Communication needs to be in language and culturally appropriate, and data and research, while numbers are important, it also needs to be inclusive of community narratives. Minus narratives, you never really know what you're talking about. Next slide, please. And then finally, what we have is, of course, the collective impact. Now, I want to be sure to clarify, as we were working on all of this as NHPI3R committees, none of us were thinking about collective impact, but after it was done, what we realized is that we had used Indigenous Native methodologies and engagement, and we had met all of those qualifications in order to be considered to meet the criteria for collective impact. So we addressed policy, research, we had a workforce, we talked about resources, we had strategies. And what we saw was we created a common agenda for change. We shared measurements for data and resources. We were mutually reinforcing our activities, which meant we were communicating and working together. We had open and continuous communication. I also think I would add in there honest, because sometimes if you're not having honest communications, then you're not really talking. And then last but not least, we have a backbone coordinating organization, which for us was Papa Ololokahi. And all of us are so grateful for all the work that POL has done in ensuring that this NHPI3R team is here and that we've been able to move forward. So with that, guys, I'm going to go ahead and we're going to move on to the next part. We are going to come to Q&A, but that is the end of our presentation. And now we're going to start, we're going to end with some of, or not end, but we have a few mahalos to give out. So as Sherry alluded to, there are some community members who will be transitioning. And that transition is not because they're no longer part of the team, but rather that they have other obligations that don't allow them to fully participate. So many of them are acting now as mentors or as committee team members. So of course we have first on our list, Felea Itao, who was our co-lead for our Pacific Islander sub-team. And taking her place will be Crystal Kiania. And Crystal is also a Pacific Islander from Tonga. And she will be filling those shoes. But of course, mahalo to Fele, because without her leadership, we would not have been able to do the work that we did. Next is Josie Howard. Josie is also one of our PI co-leads. She will as well be transitioning to mentorship, and taking her place will be Phileas Uroman. And mahalo to Josie and to WOW and for all of the work that they have done. I cannot tell you how many times I had to call upon Josie to help when I was at DOH, and how kind they were in providing resources to our Native Hawaiian and Pacific Islander community. Next is Momi, and Momi Tolentino for last year was our NHPI coordinator. And so mahalo to her. She is actually going back to Kim Haleolono. So of course, she's going to continue her work with POL, and she'll also be supporting our efforts through the communications. Taking her place is me, which I forgot to introduce myself at the beginning. So I have taken on the role of the NHPI3R coordinator. For those of you who don't know me, and I know this is late in the game, my apologies for that. My name is Chantel Matani. Everybody calls me Telly. So welcome. Sorry, it's my first community report, and it's a Friday, and it's raining. So mahalo to Momi for all of her hard work. She oversaw and coordinated everything that we just presented to you. So mahalo Momi. And then we have Kealoha Fox, who of course was part of our policy committee. She will be transitioning as well to mentor, as well as committee team participant or member for the policy committee, as well as Halai Valu, Vakalahi. Sorry, Valu, I wanted to say your maiden name, who also is transitioning. But for her, she's actually on the continent now, as she has taken over as president of one of our one of our colleges on the continent. So mahalo to all of them. I cannot thank them enough. And of course, these are just the ones who have transitioned for 2022, but we also have Ualani, Ho'opai, who also was one of our NHPI3R coordinators before Momi. So mahalo to her as well. And again, they are not leaving the team. They're simply transitioning back to either team members or as mentors. And then next slide, please. And for this, I'm actually going to turn the time over to Kim, because we also want to remember all those who have passed in and who were members of the 3R team, and for all the work that they did.
Indeed.
So Kim,
in particular, we want to remember Dr. Noah Emmett Awai Aluli. family practitioner on Molokai, Molokai Family Health Center, founder, a member of Aola Mau, the founder of Ahahui o Nakoka, the Association of Native Hawaiian Physicians, also a co-founder of Protect Kaho'olawe Ohana. His ho'oleva on Oahu will be held on March 4th. And his involvement with COVID started as early as it did for all the rest of us. And he served on the NHPI3R policy committee and on the Native Hawaiian subcommittee. But his initial activities were with the Office of Hawaiian Affairs, working with his friend, Colette Trustee, then Trustee Colette Machado, who also has passed at this point, and they worked to really look at the data, determine what the issues were, and see how we could improve on the data collection so that we could put all of that data and information into programs, services, and other actions. So to Dr. Aluli, to Emmett, we remember him and his contributions to this effort as well.
Mahalo, Kim. And just to share, my nephew, who is part of the Polynesian or Pacific Voyaging Society, and I'm sorry if I said that wrong, Kahia, he was one of the members who was able to take Dr. Aluli back to Molokai. So, mahalo. Next slide, please. So we are actually going to open it up now for questions. We have a little over 15 minutes. So if there are any questions or comments that you guys would like to share, now is the time. Ask away. And of course, we're here to answer. And I want to say before we move forward, mahalo to all the panelists for taking time out today. I know how busy everyone's schedule is, and I just appreciate all of your hard work and your contribution to this. That I do want to say there were a couple questions in the Q&A. So one of them was, this is the initial vaccination series, correct? Not showing differential for individual with boosters. And Lisa and Tertia actually answered that. And Lisa, do you want to give that answer publicly or?
Sure. Yeah, that data on that slide just reflects the initial vaccination series, which if you recall, for the two types, I think that was Pfizer and Moderna that were being put out at the time. And of course, there was a series, right? There were two that you needed to take to complete a series. And so that was the data that we were looking at the time and tracking over time. And then of course the boosters came along. And so there is data on the boosters on the DOH website. But for that particular slide, we did not include that. That's the overall vaccination for the series.
I think you're muted.
I was. Apologies, guys. Also, we have Dr. Kintu who asked if we could get a copy of the slides. We will be sharing those slides. We're going to clean them up a little bit, of course, before we post them. They will be found on the NHPI3R website, as well as a link to it on the POL or Papa'ololokahi website. So the slide presentation will be made available to those who are interested in receiving it or reviewing it or using it moving forward. Any other questions? It looks like, oh, we got a mahalo nui, anonymous attendee, to all the panelists and 3R participants. So cool to see how much has been done and what plans for the future are. And also we want to, of course, acknowledge the contribution of others. I want to make sure that everybody knows that although we only highlighted some of the work that's been done, it's super important to also recognize like there's over 60 organizations, which is inclusive of FQHC, so Waimanalo, Kalihi Palama, you know, all of them, which I know I'm going to miss some of them, so I don't want to name anymore, but those are the ones that I can think of, as well as medical providers such as Queens Medical Center, Kaiser, also Project Vision, who worked as one of our medical providers as well in doing vaccinations, the 5 Native Hawaiian healthcare systems, not only here on Oahu, but across Hawaii. So I think that's important to acknowledge them as well as all of our other partners, such as those from UH Manoa, our educational institutions, our community-based organizations, such as WOW, We Are Oceania, or MCO, MHAC, and one of our newest Pacific Islander organizations would be Happy. CNHA has done work with us, as well as the Hawaiian Homesteads. So of course, if I've missed anyone, my apologies, but we do want you all to know that your work was seen and was appreciated. And with that, I'll turn it over to Lisa. Lisa, you want to add to that? Sorry about that.
Yeah, I just wanted to clarify. I think I forgot to call out when I was doing my presentation. We also want to be mindful of the missing race data that does impact, you know, the data that you're seeing. So in some cases, you know, that is for some of the components of data collection, there's missing race data for, you know, upward of beyond 30 to 40%, depending on that data point, where we're missing the race information. So I just wanted to call that out. And then also the impact of the home testing, right? So when we think about the percentages we're seeing for percent positive cases or positivity rates, we have to remember that now that we have the home testing kits that were distributed and continue to be distributed, and that you can, you know, actually get from providers, that also has an impact because we're not then seeing, unless somebody is testing positive and then going to their doctor, we're not capturing it in the same way. And so that does also impact the data that we're seeing. So I just wanted to make mention of that to kind of provide some more context. But it is the information that we are still tracking from the Department of Health, of course, is the information that right now is the most consistent that we're able to get from the different the different processes that they utilize. So I just wanted to clarify more context.
I love that. Thank you so much. And then there is another question. What would you like to see the NHPI3R look at in the near or far future? I know I'm going to put everybody on the spot with this one, but for the panelists, I'd really like to hear, because you guys have been talking about where you see yourselves going, like what are the small goals and then what are the longer goals? So if you guys wouldn't mind, Mary, I'm sorry, can I call on you first? For comms.
Sure. I was just trying to gather my thoughts, so you sped that up. So I think the 2 areas off the top of my mind is what I mentioned. One is in working with data and research on the disaggregation. I think that's really important. I saw some information that just came out from the federal government is looking at HEDIS and in disaggregating, providing disaggregated race data on some of their measures. And right now they do not separate Native Hawaiian and other Pacific Islanders. So I think it's important, as Lisa shared, that we move this initiative up to the federal government to be sure that there is disaggregation, at least at that level, if not even more. So I think that's important. I think the other is long COVID, and just seeing where that takes us and addressing that. And of course, there are multiple issues for both Native Hawaiians and Pacific Islanders in just addressing disparities and equities, not just in healthcare, but in voice and in representation. Thank you, Tali.
Of course, thank you. And Momi, I'm going to call on you for policy. your thoughts about what you would like to see the 3R look at in the near or far future.
You know, I'm actually going to defer to Sharday as the chair. I wish that I had folded her into our presentation, because she really is sort of the face of the policy committee, along with our Pacific Islander co-chair as well.
Thanks so much, Momi. Yeah, we can do it together. I can start us off, and please feel free to add. In the future, I hope that we can be more tightly supportive of the other committees, as was mentioned, I think, throughout the presentation. I heard quite an echo around advocacy on each committee's report, and so to the extent that the policy committee can support that and you know, be a bit more specific to the initiatives going on. I think one of the strengths has been our, you know, what Sarah Kamako-Vivole has called, and I think is a great way to describe it, our broad portfolio that kind of maps across the social determinants of health. And, you know, thinking about that from that cultural model that was shared of it's innate within us from a cultural foundation, looking at health more holistically in that way. But yeah, those are some initial thoughts. And yes, I think I hope to you know, continue to participate on both the Data and Research Committee and the Policy Committee. And I think that has helped in terms of my understanding as to how policy can support the disaggregated data efforts, and however I can continue to support with moving that along. Momi, anything else to add? Or?
You know, I really did appreciate all of our efforts to elevate the voice of Native Hawaiian Pacific Islanders on the national stage, and our representation in those bigger conversations. And I know that Data and Research Committee also participated in international conferences. And so I think that I'd like to see that continue, you know, and not, as you were saying, not just silo ourselves, you know, within our different committees, but really to continue this cross collaboration across academia and government and community-based organizations, and then take that strength and that empowerment and, you know, put it forward on the continent and in these national and international conversations.
Awesome. And then the next person, and I'm not Kamahana for now health and well-being, but you know, previously for social support. Any thoughts?
I do. So I think what I learned and appreciated the most from my colleagues through this process is ensuring that the community has voice and that stays center for us. I think one good way of looking at it, as Jeannie was talking about the work that community health workers do, it's another way that connects us back to all of the committees that were showcased here today. I think I look to government to continue to address access to education and housing, as well as the data piece that was mentioned. And what I learned about the importance of data is every data point equals a person. And these are the people that we love in our families and our communities. So it's really important, because if we know what the data says, then we can tell our story and we could get the resources that we need so that we could provide the support. And then this leads us to the work that the policy will do, the policy makers, whether it's at the state or federal level. And then I guess just to highlight one of the biggest successes that I've seen is the work that Queens is doing right now in the diversity, the equity and the inclusion and justice piece that they're doing. I think we were, as a larger group doing this work for the past 2 years, are looking for organizations and people to have the courage to step forward and do that work. So thank you.
Oh, awesome. Thank you. And then I have 2 more left. Jeannie, and then I'll go to Lisa. So Jeannie, what are your thoughts?
Thank you. I think near goal right now is to just help the community with this new thing that's coming out with the benefits being stopped for most people. I mean, they're going to start calling here, and that's how community health work is. It's like you're doing something on this side and something major happens, an explosive thing happens on one end, and you have to run and help with that. So, you know, food stamps and medical, that's all going to get affected in the next several months. So that's the near. The future, just to continue to make people aware of community health work, especially the people that say yay or nay to those bills that come about, because that's very important for us to continue to do the work that we do. The National Conference is coming up in August, and you know, going out there to learn more about how they're doing it, so that the state of Hawaii can see that's important, and that's what we want to connect with. Thank you.
So, Lisa?
I would like to see everything that everybody's saying. I'd like to see that moving forward. But I really love the sort of what Jeannie shared with us when she was presenting, right? That she's one pebble, or we're like a pebble in a pond, and that ripple effect. And so I was thinking about maybe as we move forward, throwing multiple pebbles into that pond, because there's multiple ripple effects. So that idea of multiple strategies all connected back to our initial goals of the NHPI3R, the overarching those four goals. I feel that really is something for us to look at, strategizing and having those multiple strategies for each goal and moving those forward. You know, representation is going to be really critical as we move forward. And of course, you know, the data piece that continued for us, the particular community, the data disaggregation and trying to continue to work on putting out the guidance over the next year, and the working to develop the scorecard is going to be important. And then we always connect back with the different committees, right? How does this look? How are we going to put this out? What are some of the feedback? Because it's going to take all of us, I think, to shift mindset in not only data collection, but how do we then put that data into action, and how do we ensure that our government agencies are able to respond to that. So I think for me, those are all the things I'm thinking about.
No, that's awesome. Thank you so much, Lisa. And again, I appreciate you guys also making mention of the PHE ending and how are we going to move forward? Because as Dr. Kintu has put in the Q&A, once all of that funding goes away, what then happens to all of these programs that have been put in place that have been really supporting and sustaining Native Hawaiians, Pacific Islanders, and other underserved and marginalized communities? And how do we create that advocacy, again, to ensure that we're meeting the needs of our communities and that we're not just going back to pre-pandemic normal? So mahalo to all of you. We are at the top of the hour, so I do need to wrap it up, but I want to say thank you so much to all of our panelists today and all of the committees and the team members and leadership within the NHPI3R team. It has been a pleasure and an honor to work with all of you, to do the work, to be the boots on the ground, to see the changes that have really been instigated by all of you and by the work that has been done. I also want to thank our community members, our Native Hawaiian and Pacific community members. Without all of you, and I'm going to ask Kiave to share screen with my last one that gives my information. Without all of you and your support, it is really difficult for us to do the work. A lot of times when we talk about, next slide, there you go, we need you. And the reason I wanted to put it that way is because honestly, the more hands and the more seats at the table, the easier the work. So if you're interested in joining, if what we talked about today resonates with you, please reach out to me. Reach out to me. I have my number. I have my email address. Use my number. or my email address. Send me your email. Let me know which committee you would like to be a part of. Or if you're an organization who would like to join, let us know. Also, we want to thank all of the government agencies, all of those who have helped us, our funders, our sponsors, our community, our medical providers. If I have missed anyone, please forgive me, but I just want to say thank you. It is with the support of all of you that we have been able to move forward and that we continue to do this work. Native Hawaiians and Pacific Islanders don't have to be vulnerable communities, and it is our work that continues to build on empowering our communities and bringing them forward. Also, I want to mahalo all of those who are transitioning as we did. And I have a few announcements. For those of you who are interested in joining, on March 1st, we will be having from noon to 1:30 a presentation by Radix X, which dealt with and it's the Pacific Islander portion of Radix X. I hope I'm saying that right. My apologies, Dr. Tina, if I am not. And that will be giving back, during the COVID pandemic, they did a survey that focused on Pacific Islanders. So they will be presenting back to the community their findings as to what happened with Pacific Islanders, test kits, how that helped, how it maybe didn't help, social and economic issues such as living in multi-generational homes, and that type of information. So if you're interested, please be on the lookout. There will be on March 1st from noon to 1:30 a community report that the NHPI3R with the support of Papa'ololokahi will be sponsoring and having. And then also, as Jeannie made mention, we have the NHPI CHW community report. A date has not been chosen, but we will let you know. But please put that on your calendar and be on, or not on your calendar, but rather in your in the back of your mind, so that when you see something, we will definitely let you all know. Other than that, Kim, have I missed anything, or Tertia, or any of the panelists?
Mahalo for your excellent moderation, Telly.
Thank you. This has been my first.
To all the panelists.
Yes, mahalo. And of course, Dr. Kitu, we definitely know as the PHE is expiring, we'll continue to talk about how we can advocate and what we can do to ensure that the level of services that our Native Hawaiian and Pacific Islander communities have been receiving continues, and that we don't lose the momentum or the changes that we have worked so hard to put in place. So just to let everybody know, definitely on our radar. But thank you to all of you who have stayed, who have been a part of this webinar. We appreciate all of your hard work. We look forward to seeing you. And please, if you're interested in joining, reach out, be a part of our committees. And I am going to end this as Lisa ends our Fridays, where I'm going to ask all of you to put your hands up in the air and give me a dance as we dance out the Fridays, because we're happy for the weekend. And we all want to say mahalo, fa'aitele lava, Yahweh. Thank you all for being a part of today's webinar and our series for the community reports for our NHPI3R committee team members. So thank you guys. Mahalo.
Thank you.